Have you been told that your little one has a head tilt because of a tight neck muscle? But not to worry, you don't have to do anything because surgery can fix it. Hi there, it's Neesha from My Favourite Physio. In today's video, I'm jumping in to share with you a case study of a little one who we met recently here in our clinic. This little one is 3 months old and she presented with her mom and dad because they've noticed her head was tilted to one side ever since she was born. Now at 3 months old, her head shape has gone flat and it is now misshapen. Now mom and dad told us that at 6 weeks old, the doctor said to them not to worry about the neck muscle because you can have surgery to fix it. Now, that's horrible for us because that is so untrue. What baby has is a condition called torticollis, whereby the sternocleidomastoid muscle, so the muscle that goes from your chest bone to your collarbone to the back of your head, is tight. Often that happens because of baby's positioning in your womb. It is nothing you did or didn't do. It just happens that that muscle is not well formed and it is tight. It would limit your baby's ability to hold their head up straight. It will cause them to turn to one side more than the other or to have a tilt. And over time, if baby always lies in the same position, their head shape would then flatten out. So what happens is your baby actually needs to be seen by an expert pediatric physiotherapist, and we will do a full assessment of their neck muscles to see how much range of movement they have in their neck, to correct the muscles that are weak, to correct the head shape. Now it's a tailored treatment program for every baby because every baby is different. Here at My Favourite Physio, we see lots of babies with torticollis, and we are able to effectively correct that tight muscles. We are able to help babies strengthen their neck muscles so that baby can hold their heads up straight and learn to turn their head side to side, and to then stay off the back of their heads to allow the head shape to remold. Babies are then able to learn their gross motor skills and achieve all that rolling, sitting, crawling, pulling to stand and walking. Very, very, very rarely does a child ever need surgery to correct that muscle tightness. Now, occasionally, and we're saying once in 5 years, we might find a child turn up to physiotherapy at 3 to 5 years old, having not had any early intervention as babies. So their heads are still tilted at this position. Their face have literally changed so that their eyes and face is now 15 degrees or more off straight. Because over time, your face will almost change to try and get yourself a little bit more level while your head is still tilted. You'll see all this muscle tightness and their spines start to change. Now, in those situations, we will still try to do as much as we can, but they are likely to really need surgery down the road because they've missed early intervention. So surgery doesn't happen to these muscles until you have finished your growth spurts, because if they nick that muscle when you're 3 months old, when you have a growth spurt, it's going to get tight again. So if you continuously try to nick that muscle, to cut it, to loosen it, you'll end up with so much scar tissue that muscle will never work. So for one, there will be no surgeon who will be cutting that muscle regularly for any baby. If they ever need surgery to correct that and to correct the spine, that would be further down when they're 13, 14, 15, 16, 18 years old, when they finish all their growth spurt, or is near the end of their teenage years and growing periods. Now, you can't leave your baby to wait for 10, 15 years to do that. You just can't. So do not think that the only solution to a baby's head tilt is surgery, because it is not. You do not do surgery for a head tilt. What you need to do is to actually see an expert pediatric physiotherapist. So if you would like to speak to one of our expert pediatric physiotherapists here at My Favourite Physio, the number to ring is 02-9790-4233. And if you know somebody out there who's got a baby with a head tilt and a misshapen head, please like and share this video with them. Please do not think that you can do nothing about it until they're teenagers. Until next time, have a fantastic day. Bye.